Hey folks, we're back. I'm your host, BKP, and it is time for Ask the Doc with Dr. William Whaley. Dr. Raymond Tidman, how did he get a vacation? Who gave him time off?
Yeah, I know. Well, I invited Dr. Marlowe 4 times, and then he got too busy because of his thing, So I invite people from time to time. I was thinking about inviting Ray's wife, Lee, to come here today, and she'd have been, she'd have taken you for a ride, man. But anyway, so I'll invite somebody next week. Go ahead.
That's okay. We've done this.
All right.
Can handle
it. We've been
doing
it. We've been doing it for 5 years, haven't we? All right.
All right, Dr. William Whaley here, Ask the Doc. We are going to talk about, we have a set of 6 questions, or 6 not questions, but areas that we're going to try to dig into. But I want to start out, I really love this tie. So we're going to talk about that. Today's 9/11. Let's open with that, Dr. Whaley.
All right. So, well, first of all, you're supposed to get the weather. It's cool and crisp in Blue Ridge. That's the jacket.
Beautiful morning.
You opened that, with the fog out there it's just really beautiful in Blue Ridge, and we are still 14 inches above in rain. And on 9/11, I was standing at the foot of that. We were doing the physicals for the Thrasher hockey team for the opening season. I was standing at the foot of a table with Ray Ferraro, the captain of the team, and he was watching the TV behind me, and he said a plane just hit one of the World Trade Center. Well, several times little Piper Cubs have gotten off base there in New York, and I thought that, and I turned around and I looked at that picture, and I said, that's not a Piper Cub. He said, no, that must have been a much bigger airplane. Well, you can imagine in that next 2 hours where we were trying to do physicals on 90 hockey players, and it was a mess. But what I remember about that is after it was over, this country came together like this. I mean, there were flags in every driveway. People were all on the same page. We had a common enemy. We had a common purpose. People were waving the flag. The churches were full. And now we've come decades later, and the country's all busted apart again, and there's reasons I'm having a hard time with that right now. But I've always thought that the American spirit was strong, that that God had a purpose for this country, that He put these people here. He anointed our founding fathers. He's anointed our president. Somebody would stand up at some point and make a difference, like Lincoln and Teddy Roosevelt, and that we would have a common enemy again. It'd be an economic enemy, or we'd be fighting China or something. And so on 9/11 today, I just sit here and think, what is it going to take to shuffle the deck back and get us where we quit arguing with one another? And it's really bothered me a lot in the last week that we have so much division. I sent out a note yesterday that this program, I think, focuses on the science of what's going on, whether it's questions from people or we're talking about COVID for the last 18, 20 weeks or whatever it is. And each political camp sort of picks the piece of the data that fits their logo.
I could not agree more.
And it kills me.
Everybody's picking out what they want and that's what we have done for 18 weeks. And I want to say how much I appreciate you. Look, this guy is studying, researching all week to bring this information, and we don't bring the 2 political camps. We bring the information. We're going to get into this, but you were talking about that morning. I showed a picture of 1973. That's when the World Trade Center opened, and I'll never forget, as a young kid, all the people. I lived where we could see the skyline. We could go and see the skyline in New York City, at that time, you go to New York quite often. You look up and it's like birds, helicopters, small planes. They're going everywhere. And when the World Trade Center opened in 1973, all the talk was, when is one of those little planes going to go right through the tower? These are the first 2 towers. Everybody was like, wow, When's a plane going to go through those towers? How are they going to keep? So that morning, when I got up and the first report of a plane going in, first thing out of my mouth, and a lot of my friends were, finally one of those little planes went through that tower. We knew it was going to happen. So that's,
well, they've hit the World Trade Center more than one time with small airplanes before this, and they'd hit the Empire State Building more than one time. So it was a tragedy. It was cleverly constructed by Osama bin Laden, and he paid the ultimate price years later. But it's too late. We got to get to a more cheerful topic here.
Yes, we do. Now, and I've got an all-star political panel that will want to discuss that, and then we got to move along. You sent over some things, and sometimes on here, for the most part, I try to show you some data. You can go to the Georgia Department of Health,
which I've got here, and we're going to talk about in a second.
We can go into that, but I would like to take our time. Dr. Whaley will talk about that and get right into some of the concerns you have out there that we're living in on a daily basis. Your number one is we often wonder how long, if the virus is on the surface of this computer, if the virus is on the surface of this microphone and we're putting it up and touching it, how much danger is there from the surface infection from common surfaces, and how long does the virus survive on various surfaces?
All right, this is.
Do you have that one picture up, Emily?
Yeah,
put that one up.
Put that one up in the corner over there. I'll come back to it in a minute. This has come up several times in the news this week. If you look at every week, we look at the number of tests that have been done for the week, and that number of tests done in Georgia is getting huge now. There've been 2.5 million tests done, and of all of those, 10% are positive. Now, remember back where it was 17% in the past. We're trying to get the weekly or daily number down below 5. It's at 7.1 this week. So that number keeps coming down in terms of the percentage of positives, while the number of positives obviously goes up. If you do 10,000 cases in a county in 2 weeks and the 5% or 7% are positive, you get a lot more positive cases. Now, how many of these are important versus how many are not important? Well, we've already figured out. See, I got my mask hanging on the speaker today, like you have it hanging on your rear view mirror in the car. But that mask is going to be with us for a long time, and people are still using their hand sanitizer. But in the news this week, there are a number of cases that have no known exposure. Correct?
Yes.
I've got patients. My personal patients this week have one was at the revival.
Okay.
One of the deaths this week is a patient of mine whose family came up from Florida and spread the virus to their parents, and it spread around, and they got admitted to the hospital down in Jasper, and died. So most of these, they got it from somebody. But these sporadic cases that come up, you've heard frequently, well, maybe they got it from these asymptomatic children who are carrying the virus. And it seems that we have become less concerned about the elevator button, the handle of the shopping cart at the grocery store and so forth. And so I've had patients that are just real compulsive about washing their hands and real compulsive about their mask, but have forgotten the surfaces. So that graph that you've got up there, yes. We have established here, and particularly Ray likes to say it, if we're out here like this, that virus is gone in a few minutes. So if you got the sunshine's gone in 20 minutes. But on metal then would be the shopping cart,
right,
glass, or ceramics. The virus lives 5 days. In plastic or stainless steel, 3 days. Paper and wood, 4 to 5 days. cardboard, like you'd get in a box coming from Amazon, is 1 day. Aluminum, 2 to 4 hours. Copper, 4 hours. And food, there is no evidence that it stays on food at all. Well, there was a thing in the news this week showing a doctor, and I think this doctor was also in Minnesota, where there's a lot of people that are a little kooky, and he was wiping on every apple and peach and everything he had purchased at the grocery store that day, wiping it down and making it seem as if you should really be wiping down your vegetables and stuff that you picked up at the market. So I contacted our viral expert, and our viral expert said he wipes down boxes and things if he doesn't self-check out and self-bag himself, okay? Meaning that somebody at the store handled it and gave it to him with their hands. So I think somewhere in the middle is I never go into the supermarket that I'll take one of those wipes out and thoroughly wipe the thing again. And then I keep my hands on it.
There.
Yeah.
Did you do that before the virus?
No.
I did. Okay, go ahead. I did.
A lot of people did because of the flu, and they were suggested that they do that. I did not. So I do that.
I give my shopping buggy a bath before I go.
Well, I don't. I give the handle a bath.
You think I'm washing a car? I got to tell people to go around. I swear. Go
anyway, and I use that thing as a hand cover when I'm picking out boxes and stuff off the shelf. So anyway, that's how long this stuff lasts. So then the next question that I've gotten from patients now is, what should I do about cleaning the interior of my house? And what do you think my answer is? You don't need to clean the interior of your house for the COVID virus unless somebody's been in there that's likely to have spread the COVID virus. I mean, it's your house, it's your people, it's the unit that you deal with. You don't need to go scrubbing down everything in the house with the Clorox wipe all the time. That Clorox wipe is for you when you're out in town. Keep it in your pocket, and if you're going into the stall in a restroom, clean everything off as you get in there.
Right,
but
I think I would like
don't
to ask
go
a question
paranoid. That's that next number 2 slide there. Is that one about how to clean up stuff?
Go ahead and put that up. I have a question.
Yeah.
Okay, so before COVID-19, taking stuff home from the grocery store, your perishables, your fruits, your vegetables, we should have been washing them thoroughly before COVID-19.
Okay, yes.
Okay, now wait, I got to get to my question.
Wellness's thing. Yeah.
Right, we should be washing them. Before COVID-19, all jokes aside, I go to the grocery store, I get my buggy out, and I wipe it down. I wipe the handle down really well, okay? So there's so many things that we should have been doing, okay, before COVID-19. Now here's my question. When you say it's on a box, it's on a surface, how does it get there? See, that's what we're talking about, how long it lives.
Okay, that's the point that people were trying to make.
So if you're saying you're taking your cereal box off the shelf at the grocery store and it could live on there X days, how did it get on the cereal box?
All right, we do know that several of the grocery stores in this area have had high numbers of positive employees.
Okay.
So the guy's got a case of Cheerio boxes here. And
Good choice.
He sneezes. He sneezes on the top of the box as he's putting it in there. Now that you expect would be a high number of viral particles on the top of that box. Now it's only going to live there 24 hours. So how fast does Cheerios turn over on the shelf? I got no idea how fast the Cheerios turn over on the shelf myself, but that's the basic issue. So that it's a dose issue. And so particularly you take the toilet stall, how many people going in there and sneezing and coughing and doing one thing and another, you're going to wipe down that thing really good. But on the Cheerio box, that's how it would have to get there.
Let's go with a sneeze. Let's use the sneeze for an example. So if a person is stocking the shelves at the store and they sneeze on the box, Okay,
Yeah, and a lot of them are wearing their mask like that.
I got it. And or they sneeze on a surface. Okay, how it gets on there, now we know. Now you said cleaning our homes. Okay, is this transferable? So if I pick up the box that's been sneezed on, the virus still alive, I have human skin here. Is it transferable from surface to surface? So if I come home and I set the box of Cheerios on my kitchen counter, is it transferable there? And
Well, first of all, I would say
that may not be a good question for those out there.
No.
But
I
for
think
me,
I think it is. I think the technical answer is you never say never and you never say always. So you say if it is it transferable? I would say of course it is. Is it transferable in a sufficient dose after it's been on that box 12 to 18 hours
Right.
to do you any harm? I think the answer is no.
okay. Well, you're moving right along through here.
And
so
I
I'm
was
not bringing
also
them up.
told by my expert there will never be any sort of a clinical trial to prove or disprove this idea, because you recognize we're going to talk about clinical trials in a little while when we're talking about the vaccine, but the only thing you can really do is go around to places and test the virus to see if it's there or not and what the dose is. Well, we haven't reached a point today where we know what a dose that is infectious is. Remember, when we do this PCR test or we test somebody and they're positive, that test doesn't come back. They're positive with a million particles per drop or 10,000 particles per drop. And we've said before that this mask is going to diminish the amount of virus I get when somebody sneezes in my face by somewhere between 20 and 60%, and that'll diminish the chances that I can get infected, right?
Okay.
So basically that idea of how much is on there and can it or can it not cause a problem, we're not going to have a real good answer to anytime soon. So be prudent. But we're not wiping down the stuff that we buy at the grocery store in our home. Period. I mean, we're not doing it. We are washing our hands and we're making but we have not wiped down any Cheerios boxes or any bread things in our house. So we are not going overboard. And I really don't think you need to clean up your house.
Well, wait a minute. That's another subject.
Oh, excuse me.
This is
You don't
Ask the
need to-
Doc.
you don't
This
need
is-
to-
It's not Ohio. Don't
Oh,
get
yeah,
us in.
whoa.
Don't get us in trouble.
My answer for cleaning up the house is you should clean it up like your mama's coming to visit, but don't worry about the.
There you go.
the
That,
virus.
nice catch.
Your mama's
nice,
coming to visit.
nice recovery.
Yeah, okay. Because my mother-in-law is with me, and our house is very clean.
All right,
because she's
moving right
visiting.
along
All right.
because you have this in chronological order.
I do.
Which you've got it down now. You
All
start
right.
to talk about should people get tested after recovery, and if so, when, why, and how often.
But this has got a lot to do with the vaccine trials and with what's safe. We just had a talk this morning offline about what should be done in schools. Can you put up that next one there? It says symptom and time-based strategy. This has changed within the last 12 weeks so many times. I said last week we'll probably have new advice next week, and actually we now do have new advice from this week as to last week. But this is what they call the system time-based strategy. It's just a real quick outline. If you look at it, when you have a symptom of the COVID virus and you are going home to be quarantined, but you have not been tested, how long do you stay home?
10 days.
Right. It used to be 3 weeks. Then it was 2 weeks, and now it's 10 days, right?
Yeah.
Okay, now you went home with symptoms and were not tested. You know, you're blowing your nose or something. How long do you stay home then? You stay home until 3 days after you've had no fever, no symptoms, and no anything else.
Not everything's COVID.
No.
If you don't feel good, not everything's COVID.
Particularly when you got
This
the
is
mold.
the time
and
of the year where the eyes are watering
Yeah,
a little
look
bit,
at mine.
sneezing.
Right. Yes, right.
And you might not feel great, and you know, because of the change in the weather.
Yeah, and everybody who gets the sniffles from the mold, or the guys are over here doing construction and blowing stuff around, you can't go get tested every daggum 2
Right.
weeks. So you don't get tested. You go home and you stay a few days. If you don't run any fever, you come back to work. And if you get a test and the test is positive, you go home and you stay 10 days, you go back to work. Now, we were talking about the football game.
Yes.
And I was going to get into this after we finished talking about the antibodies and everything else, but this actually brings up this business about the football game. 3 or 4 weeks ago, you'll remember, I first mentioned that there seems to be a cardiac manifestation to the deaths in the ICU, and I brought up then that
Yes.
ACE receptor and how the viral gene can make your heart and your kidneys and other things increase the ACE receptor so that the virus can attack these organs, and if it attacks them all, then you get multi-organ failure and you die. Well, a week or two after that, I said, look, it can increase those ACE receptors in your heart, and even if you're not particularly sick, there's evidence that at least 20 or more percent of people who have the virus and are sick have a cardiac manifestation, even if they don't have any symptoms that can be detected by cardiac MRI or fancy tests. Well, it came out on Monday, this is Friday, it came out on Monday that the information that had been given to the Big Ten presidents and athletic directors of all of the Big Ten schools had been fallacious. The Big Ten medical director had quoted a positivity rate of, what was it, 45%? Yes, 35%. And the school said 35%, that's too big a number, we're going to cancel for the season. Well, they were the big first ones, right? Then the Big 12 and other people canceled. Well, it just came out on Monday that he had misspoken. That number was closer to 10 to 14% were positive. Now we know of that 10 to 14% that are positive, 10 to 14% of that. So what's that? 10% of 15 is 1.5. So let's say 1.5 out of 100 of these kids who get positive tests will have some sort of cardiac issue. And that's why Ray and I said a few weeks ago, if an athlete's positive, before he goes back to play, he needs to go to his primary care doc
And get a checkup.
and get established there.
Right.
He does not need to have a cardiac MRI. That's overkill. You'd be doing 100 cardiac MRIs for one kid. But you got to watch that kid, and the trainer's got to watch that kid and protect that kid. If he starts not performing well, he comes immediately out, and then he goes to the doctor and gets taken care of. So you're talking about having a game canceled because one child had a positive COVID test, and that positive COVID test turned out to be false positive. Let's leave it at positive. One kid had a positive COVID test. It's my opinion that that kid should stay home, that the athletic events should go on, that they should not do a hazmat cleaning of the locker room. They should not treat that kid like Typhoid Mary. Let the kid go home and stay 10 days and go on and play your game. But, and as I said a few weeks ago, if your star quarterback tears his ACL in the middle of the game, you got to have somebody take his place. And so if one kid can't play, somebody takes his place. So anyhow,
if you have, flu's contagious, and there's been a lot of argument, and I don't want to get into that on the difference in this and the flu, and I don't want to go there. I'm just talking contagious is contagious.
Yeah.
Flu is contagious.
This is
A
more
cold,
contagious.
I
yeah.
can give you a cold. Right. There's more, but I can give you a cold. I can give you, so contagious is just that.
Qualitatively, it's the same. Quantitatively, it's different.
Right. But if you test positive for COVID, it's contagious. But, send that person home, play the football game. We are not playing a game. Fannin County is not playing right here where we're sitting. They're not playing tonight because of we understand one negative, positive, negative, what is it called?
Positive test. False positive?
False positive.
Well, let's leave it positive. Let's just leave it positive.
Even if one.
Yeah.
Play the game.
Play the game.
Play the game. Okay.
All right. Well, anyway,
now,
so
moving right along,
this whole thing began with began with the idea of being retested. So I've shown you that. So what we were saying before, now this rule is still in place with some employers, is that if a healthcare professional went home ill, he couldn't come back to work until he'd had 2 negative tests.
Right.
And then you remember it went to 1 negative test.
Exactly.
And now about 2 or 3 weeks ago, the CDC said, don't test people after this because they can shed the virus for up to, how many days, Emily? How many days can they shed that virus? I'm going to do you like I used to do Lonnie. They can shed the virus for 3 to 4 months after they have recovered. So it makes no sense to test them. And that's what I went back to say at the very beginning, because the test doesn't tell you how many viral particles they still are excreting. And it's felt that the dose is so small in that positive test that they are not infectious. So that's why you're able to go back to work and not have to be tested. Now, that brings up immunity and the next place we're going, which is the vaccine.
Right.
All right, we said last week, 2 weeks ago, one case.
Before you do that, when you say the vaccine, this is where when you opened up, you just hit a home run out of the park, grand slam. The vaccine is where political parties are picking out what they want to hear. And the reality is, my true feeling, this is my opinion, is the medical industry, these laboratories, they're going to work at a rate and they're going to develop it and they're going to put it out to the public when it's ready, not ready for any political party.
That's correct.
Ready.
That is
correct?
Absolutely correct. Yes.
So
and
I don't feel they're being pressured to put something out too early.
No, I think they're being rewarded with bonuses and money to you know, they're working 7 days a week, 24 hours a day, and they're being paid for it. Just to hit right there, Russia and China put products out there that should be in phase 2 trials, and we'll talk about that in a minute, which is 6 or 8 months before you could ever say that vaccine was safe. All right, so anyhow, now this brings up the fact that you don't want to get retested because you're going to spread the virus for 3 to 4 months. That's the first issue. 2 weeks ago, we said, there's been a proven case in Hong Kong of someone who had the virus, recovered, and 4 months later had the virus again. Is this going to be a real issue? Last week, there were about a dozen cases in the United States and in Western Europe that were well studied that were exactly the same. So what it has been said now is that if a person has recovered from the COVID virus 90 to 120 days ago and again gets the appropriate symptoms, they should be retested, and they may very well have the disease again. If they have the disease again, and they got enough data now on the cases, it's not going to be as severe as it might be. So there is some thought that they didn't get immune to it, but they got a lesser case. That now puts us into what is a vaccine and when can it be marketed. Now, I'm not going to put Emily on the griddle again. I might put somebody from the expert panel on the griddle, but a vaccine cannot be released until it protects 50% of the people that got it experimentally from the COVID virus. You knew that was true?
I get that.
Okay, so that's going to take a lot of people over a period of time before you get the 50% number. Now think, flu vaccine. How many years have we said the flu vaccine this year was only 35% effective? Or the flu vaccine this year was 65% effective? I've never heard anybody say the flu vaccine this year was 100% effective. They didn't, is it?
No.
The best I've ever heard was 75% effective. Well, the difference between 50% effective and 75% effective is not a big number, and there are frequent years where the effectiveness is below 40. So if you are not going to market a vaccine until you have proven that it can be 50% protective, that is going to take a significant length of time for the phase 3 clinical trials. Phase 1, remember, is they just give the vaccine to a small number of people and see does it kill them. And does it make antibodies? Well, if it doesn't kill them and they make antibodies, they then go to a much larger number of people and they give them the vaccine and they say, does this vaccine cause, at phase 1, they raise the dose of vaccine and see what dose of vaccine produces the right amount of antibody they get and doesn't make people sick. And in phase 2, they then say this dose of vaccine we're going to give to 10,000 people, and we're going to measure the amount of immunity they get, and then this is going to be a blood test on immunity. The phase 3 clinical trial is where you have the 30,000 and the 50,000, and then you want to know, of the 30 or 50,000, half of them got saltwater shot, right? They didn't get a vaccine shot. So now you got 30 or 50,000 people, 25,000 got a saltwater shot, and 25,000 got the vaccine shot. What's the incidence of COVID virus in the ones that got and the patient doesn't know what he got? That's important. So the guy that got the shot doesn't know what he got. The doctor that gave the shot doesn't know what he got. It's just a code number. So how many people in that 25,000 group got the COVID virus and died? How many that got the saltwater shot got the COVID virus and died? Then they start getting some data. How many people in the COVID virus shot got some strange illness? And I'm going to come back to that again in a minute, like Guillain-Barré syndrome, which was caused by a flu shot decades ago, right?
Right.
Now, that's why it's going to take a long time. Everybody panicked this week when they shut down the vaccine trial of that Cambridge vaccine, Abbott Labs, I think, because of an adverse event. Don't panic. Every clinical trial has automatic stop points in it that if something happens, you stop right that minute. You don't stop.
Those are set up in the trials. That's set up in the research and as they're getting their data, but it got spun like something major happened.
Yeah.
But that's built in.
Yeah, that's built in.
It's not okay something happened, but that's built in.
Yeah, here's what
and that's not unexpected that something could happen.
No,
okay.
Now, and it probably could have had nothing to do with it. So let me go ahead with what happens here now. So, you look for certain things. With a vaccine trial, you're obviously looking for neurological stuff. Well, 1 week before that, they had slowed the vaccine trial down for a week because there was a neurological event, which they only took them about 12 hours to prove was a case of relapsing multiple sclerosis that had not been previously diagnosed, but with a quick MRI of the brain, they made the diagnosis immediately. This patient's got multiple sclerosis. They go back and take a history, and oh yeah, well he was weak and he fell a few months ago, so they immediately went back to the trial. But when they say they stopped the trial, people think, oh my God, they're not developing the vaccine anymore. Yes, they are. They just, as of that day, they aren't adding anybody and giving any new shots. They've still got the 22,000 people out there they gave the shot to. So they're still testing, they're still going right along with it. They've just got a halt on adding new people to the trial. I don't even know why that made so much news. I mean, it happens all the time, and it's a built-in safety mechanism for clinical research, and I've been involved in phase 1, 2, and 3 clinical research for 50 years in cancer, so I understand it well. You don't panic. Now, there may be clinical signs that come up, oh my goodness, now there's 2, now there's 3, now there's 4, then you can really do something. But the clinical trial's ongoing.
I know we want to get a couple more subjects in before we close on our time. We're almost out of time.
What? You're kidding me?
Well,
all right. I was going to.
I want you also to touch on the news out there, and it's not political. The news is it's unlikely that we'll actually have the vaccine ready for you to line up and take the vaccine in October.
At the end, it was supposed to be. I think the president said November 1st.
Right.
So if they say it's unlikely, and this was the National Institutes of Health who said it, so it wasn't the CDC. Now, a little bit different, right? that it is unlikely, well, I just told you, I think it's terribly unlikely that there will be a vaccine proven to be 50% effective and safe by October. I think it's going to be very unlikely that it's going to be there in January. Now, I hope that it doesn't happen in this country like it happened in China and in Russia, that a vaccine that has not finished clinical trials and done, as I said before, is given to the public. When it's given to the public, who's going to be the first people that have to take it? Healthcare professionals, because if you don't take it, they won't let you in the hospital. So first responders and me are going to have to take that vaccine whether we want it or not. And I want to take that vaccine after it's had good clinical trial data saying it's effective and safe, period.
Got to move on, number 5.
All right.
We got to get out.
All right, so we're going to follow up on what's happened in the schools and the colleges.
Okay.
Because I think we sort of did that with that football game. But it appears that the colleges that are having these huge, what do you say at the University of Georgia, an epidemic of positive cases or some such thing.
Oh my gosh, explosions.
Right. Explosion.
Of
now,
positive cases.
Yes, okay, well that's the same thing as this Sturgis motorcycle rally. It is just absolute. I mean, to me, it's snatching data and making Chicken Little or mountain out of molehill or whatever it is. We expect these young people to become positive. When you go to college now, they're testing them once a week, 3 times a week. So you're just testing this group of people terribly often, whereas everybody that they went to high school with who is out there in the world doing construction work or doing some other kind of work isn't getting tested. They're only getting tested because they went into the college where they're testing everybody. If you had an equal number of people of equal age that weren't at the University of Georgia or North Carolina University, they'd have the same number of positive tests. And you didn't go out there and shut down the University of, you didn't shut down the rest of the world when they're in there at North Carolina shutting down the classes.
Excuse me, 8:46, folks, 8:46 is the time the first plane went through the North Tower, 9/11/2001. Go ahead, sir.
Anyway, so following up on the kids, colleges, schools, and recommendations, again, I've already touched on the athletics. Parents, let your kids go back to school, let them go to college, let them follow the instructions, don't go to the bars and so forth. And if one of them gets positive, let him go over to whatever dorm it is where they're isolating them for 10 days and let them do their classes virtually for 10 days. And when their 10 days are up, let them go back to class. So much of college,
They finally found that COVID-19 is actually what cures or helps parents keep kids out of cake parties.
Yeah, right.
I mean, just saying, you know.
I heard exactly the same thing.
I'm gonna say I love your closer today. If this is it, can I go out to eat? I love this, but realistically, a lot of people still wondering that.
I had a patient yesterday who lives in Hiawassee who has not been out of the house since late March, and whose whole deal with his wife, they're in their 70s, was date night that they've done for years and years.
Okay.
And they're trying to recreate date night at home. I said, well, that's fine, and it's very good. And neither one of them have any significant comorbid conditions. I said, look, I know that in your area they've got restaurants with 6-foot apart tables or outside seating, and people are wearing a mask. And if you want to have your date night, for goodness sake, go have your date night. And just go to a restaurant that's following the instructions, that has got social distancing at the bar, they've got the tables the appropriate distance apart, and go have your date night. And just be cautious about it. Wear your mask when you go in, and clean your hands when you go out. But go on out of the house and have some fun.
Folks, he doesn't just get all dressed up, which he does for this show. He's still got to go to work.
Yeah,
Goes to
right.
work. Guy
Yeah.
works. And he studies and he brings great research. We want to thank Dr. William Whaley. And we also want to thank North Georgia Cancer Research, affiliated with Northside Hospital. We want to tell you on our YouTube channel, FYNTV, Fetch Your News YouTube channel, you can always find these segments under Ask the Doc. Share them with your family and friends. And on FYNTV.com, Ask the Doc, all the current segments on there. Dr. Whaley, I appreciate you very much. I know we could put a lot more time into this. It's
Yeah, we had 6 more pictures here.
I know, but I got an all-star panel here, and I even got sideline panelists ready if you need.
Yeah, you got Pet of the Week.
I got them everywhere today.
You got Pet of the Week coming.
And they're
man.
ready, and they're ready for their opinion.
All right.
I appreciate you very much, Dr. Whaley. Again, thank you, North Georgia Cancer Research Center, affiliated with Northside Hospital. Take a break. All-star political panel when we return.